Welcome to Call 911. This is a free webinar presented by Holmes Murphy as part of our service to the fraternal community. Today we are featuring Ty Wooten and Nina, the 911 Association, seeking to help students understand that death is not survivable, everything else is. My name is Rob Mraz, and I serve Holmes Murphy as a client advocate. I'll be your moderator for this evening. Before we begin, I would like to go over a few logistics regarding the audio and web-based features of today's program. The only people you will be able to hear during the webinar are our presenter and me. Any questions or comments should be proposed in the messaging panel on your screen. If your messaging window does not appear, click the icon at the lower left corner. The presentation you are viewing right now will be advanced remotely, so simply sit back, listen, and watch. If you have any questions throughout the program, feel free to type it into the message/conversation panel on the screen. Please note this webinar is being recorded to allow those who were not able to join us today to gain access to the material. And now let me introduce our presenter. Ty Wooten is Nina's Director of Education and has been working in the public safety arena for nearly 25 years. In working with Nina, Ty oversees the development and delivery of the organization's educational offerings, which are accessible to more than 13,000 Nina members. Ty began his public safety career as a communications officer, and over the coming years held positions in both communications and training. In 2008, Ty became the first director of Hancock County 911 Center, where he managed emergency communication systems, including enhanced 911 and radio communications for 10 fire departments and 7 police agencies. He also served as the director of the Indianapolis International Airport Communications Center. Before coming to Nina, Ty worked in public safety consulting and management, providing services that included PSAP consolidation, access control, and management planning. Ty has received instructor certifications from numerous associations, including the Center for Domestic Preparedness, the National Association of State Fire Marshals, and the Florida State Fire Academy. He has also held previous positions in law enforcement as a firefighter, as an EMT, and as a hostage negotiator. Ty previously served on the Nina Institute board and has also served as a member of several state and national boards. And with that, I'll turn things over to Ty.
Good evening, everyone. Thank you, Rob. It's a privilege to be with you tonight, and we're excited to be here to talk to you a little bit about 911 and kind of how you, as those in the fraternity community, can have an impact and make a difference in other people's lives, as well as still continuing to have a little bit of fun in all that you do in your college experience. So today we're going to talk a little bit about why people don't call 911, what you can do to help to save a life. We're going to talk about some basics about how 911 really works, understand some bystander laws and the liability of your non-action. And hopefully we're going to help to inspire you, to each of you and your organizations, to step up to lead. And because this is really a leadership aspect, stepping up to take action and address the challenges and be a part of the solution, and not just continuing the narrative of the negative things that have happened in the fraternal organizations over the past few years. So let's get started, and we're going to talk a little bit first about the fact that everyone thinks it's never going to happen to them. I mean, we all believe that you know, these types of situations, we're never going to be put in that type of an incident or a situation. And we've all seen the stories of, you know, a co-ed who dies because of alcohol poisoning on a fraternity row at a party, or someone who falls into a river as they stumble home from a party and they don't get out, or someone is a victim of an assault or worse because they were somehow incapacitated. And, or even worse, the fraternity or sorority is suspended or gets banned completely from campus because of someone getting hurt or even killed. So we have an axiom that we talk about a lot in public safety, and that is, if it's predictable, it's preventable. And so these things are predictable, right? We know that we are going to have parties and things are going to happen, but what we do after those things occur is really what sets the tone for whether or not it's a different outcome than the ones that I just described. So it's really not what it's supposed to be. As we think about and we listen to the narrative of the last few years of the negative things that have come out of the Greek and fraternal organizations that have had incidents that have occurred across the country, it's not supposed to be that way, right? You as members of these organizations, if you look at your mission and your motto, a lot of them talk about things like duty and honor and commitment. And as I began to work to pull this presentation together for each of you tonight, I began to look at some of the mission statements of your organizations, and I'm struck by some of them. One in particular, let us strive for that which is honorable, beautiful, and the highest. Another one is, let us steadfastly love one another. Another one is, do good. And friendship, character, fairness, and community. And I think that last one really hits home to the next bullet, is that you are a member of a community, whether you're a member of your fraternal organization, member of your university, a member of your community. As a citizen, we all have a responsibility and a duty to help those who are in need. And I'm struck by so many news articles and discussions that I have with friends who have kids in college, just like you, about the amazing work that these fraternities and sororities do, the work of community service that they put into not only their university, but the broader communities. And that's positive things that you are all doing, and that's what really it should be about. But too often, we worry about the consequences instead of stepping up and doing what is right and doing what we should be doing to get involved in a situation because we're scared of those consequences. And those times when we don't step up and do the right thing is when things turn tragic. What can you do? What can each of you, as your organization, what can you do to prepare to make sure that these things don't happen to you? Well, first off, I think being prepared helps you be a better person, right? It helps to save a life of one of your brothers or sisters. It saves your fraternity and sorority from serious consequences that may occur. And we're going to cover some of those consequences a little bit later in the presentation. It helps to create a safer community and increases the standing and reputation of the fraternal societies that you are all a part of. And that's important in today when there are at so many times the negative comments that are what people initially come to think of instead of the reality of all of the good things that each of you and each of your organizations is doing. So I want to take a second and just talk about a thing called the bystander effect. And it really is why people don't help. First, they think that it's somebody else's responsibility. Like, I'm not going to call about that accident because somebody else has already done it. I don't need to call. Or I don't need to call because it's not my responsibility. It's the house mother's responsibility or whatever. And the reality is this: if it's not you, then who? And you can't guarantee always that someone else has taken that step. So it's important and imperative that you do what you know is to be right. And I know that each of you have been taught how to dial 911 going back to your, very early in your, as a child, in school. That's one good thing we've done in public safety and in 911, and that is to really help to educate. And so we all know that you know what to do. It's just about doing it when you need to do it. And a part of that is not only, if you don't do it, who will, but there's a lot of people who stop and say, they're going to be okay. It's not that bad. They're stumbling around, but they're going to be fine. And we kind of feel like we're not I'm not their keeper. They got into this situation. They're going to get themselves out of it. Well, that's not always the case either. Sometimes we need each other to step up and help each other out. And third, we're afraid of getting ourselves in trouble. I know there's a lot of concern that if I dial 911 to try and give aid to a fellow member or someone who is in trouble, if I've been drinking and I'm drinking underage, then I'm going to potentially get in trouble and I'm going to have to go to jail, or I'm going to get a ticket, or whatever it may be. There's a lot of things in life that you have the opportunity to do, and you have the opportunity to make different choices. There are a multitude of different consequences to those choices. I will tell you, the only choice that is not something that we can work through and survive is a choice where we didn't do something and it causes someone else's death, because it's the only mistake that's not survivable. And really, that's the key thing that I want to drive home today and tonight as we are here together, is that it's okay to call, and it's important for you to make those calls. And next, we're going to talk a little bit about some of the statistics and some of the things that help to make it okay to call. First off, I like data, and I like statistics, and I like information like this because I think it drives home the importance of these things. 68% of teens report a fear of getting in trouble as a reason not for calling 911. And this Cornell University study that indicates that while 19% of the students indicated that they were in a situation that they should have called for an alcohol-related injury, only 4% of them actually made the call. And so this is where it's important for you to understand that in a lot of states, there are things called lifeline laws. And this graphic that's here on the left is a graphic that I found from my state where I live in Indiana. Indiana has a lifeline law, and it is a very important thing for you to be aware of and all of your members to be aware of, those places where there are lifeline laws. And I'm going to get into that in just a second. But I want to tell you and talk to you about the fact that in a one-year period following the implementation of one medical amnesty policy, which is kind of the policy that makes up these lifeline laws, The number of alcohol-related EMS calls increased almost 700%. And the study also showed that 911 calls have increased, and a fear of the repercussions of judicial repercussions, can't speak this evening, decreased, all the while that drinking levels stayed the same or even dropped, suggesting that there was not a presence, that the presence of the policy itself didn't encourage drinking, but only made it more important to understand that in these types of situations, if you are in a dire situation, that making the call is the most important thing, because there's example after example after example of co-eds dying because someone didn't make the call. And we're fairly confident that if someone had and they'd gotten the help that they needed, that they'd still be here today. So here is a map of the United States, and all of the states in the red are states that have medical amnesty laws or lifeline laws. As they're often referred to as. They grant limited immunity, meaning that there's a certain amount of limited immunity that you gain by actually making the phone call. In order to receive that immunity, you have to demonstrate that you're acting in good faith by fulfilling some expectations. One of those expectations is providing your full name and other relevant information at the request of law enforcement and 911. Number two, remain on the scene until law enforcement and other emergency personnel have arrived and that they have dismissed you from the scene by the law enforcement officers and the other public safety personnel who were there. And third, cooperate with the authorities on the scene. And if you can do those three things, then you can receive that immunity. And then you're not going to get in trouble for calling to help save someone's life. And you are not going to be put in a position where you're going to risk those consequences of maybe being underage or whatever it is in regards to that situation. I think that's really important as we think about that. If we can just take that little step, and those aren't big asks and not big requirements, just stay there and provide your information and cooperate with the authorities. And I know it's counterintuitive. You want to probably, I've been in those situations too, right? When I was in college, you would have thought that, it's an okay response to think I need to get away from here. But the reality is the best response is staying and helping the people who are in dire need. So I want to talk a little bit about kind of the 911 system and what that means. Some of you may have never had the opportunity to call 911, so I want to talk a little bit about what that is like and what to expect when you call that 911 number. It's more than a show on Fox, by the way, and it's really nothing like that. And it's not the Halle Berry movie from a few years ago either. In fact, it's a very stressful job, and there's about 5,800 911 centers across the United States in today. Those 250,000 911 professionals take about 275 to 300 million 911 calls each and every year. and it's a very important job, and one that I have the privilege to be able to say I get to go and talk to these professionals in a number of different places around the country and even around the world. And I'm, always amazed at the stories that they are experiencing and they're hearing in those 911 centers. Some of them can be very horrifying, and yet at the same time they're continuing to do their work because they know they're making an impact and having an impact on their community as well. So when you dial 911, the vast majority of the communities who answer 911 are going to be able to provide you with life-saving instruction right away. It's what we call the use of a number of things called protocols. These protocols have been highly researched by physicians and other professionals within the different facets of public safety, and we're able to get the initial information that we need and start the response. At the same time, we're able to provide you, each one of you, with information that may help to save that person's life who is in danger and that you're calling about. These, instructions and all of the information that we're asking, sometimes we get, questioned, why do we ask so many questions? All of those questions serve a purpose, and each of them helps us to determine the right response to get the right pieces of equipment and the right professionals there to help in your time of need or the person you're calling for. And that all of those things going together make up that 911 call. The most important thing for you to be able to tell us is your location. Providing a specific address, like 205 East 14th Avenue, and the particular apartment number. If you don't have an exact location, you're visiting someone, you don't know their actual address, look for landmarks or other things that can help give you a clue. Look at names of dorms, buildings, other fraternities or sororities that are around. Those commonplace names are a huge help to 911 professionals if you don't know your exact location. We have things we call commonplace files, and those commonplace files are in those 911 centers, and we can look up the exact location, but we need something from you. And anything you can provide is better than nothing. And because this is the reality, and this is where it kind of varies from what you see on television and in the movies, we do not know exactly where you are. We don't have magic technology that knows that. We're improving that, and at a day not too distant future, we're going to have better location accuracy. And it's hard for a lot of people to believe that and understand it, because each of you are using Uber or Lyft, or you're ordering a pizza from Domino's and you have in the middle of a beach and you have no address, and yet they can still deliver it to you. Those physical addresses, we're working on it. NENA, the organization that I work for, has been leading the charge to get that done for the last 15 years, and we're working at it, and it's slowly happening. And in the next few years, 2 or 3 years, it's going to get there. But it's a massive change, moving technology from really old analog technology to the current IP technology that helps us and what all of these other systems use today. So not only the address is important, but exactly what is going on, what's wrong. Telling us exactly what's happened is paramount. Not only once we can get someone there, getting the right pieces of equipment and professionals there is important. Any additional information that you can provide, the approximate age, sex of the person, is the person breathing, are they conscious, are they bleeding, any of those types of things, because then we can help to provide you with information about how to stop the bleeding, how to do CPR, how to do rescue breathing, all of those things. We can talk to you right on the phone and tell you how to do those things. And so you're helping to create a zero time where there's a responder there. It takes time for law enforcement, fire, and EMS to drive to where you are. But if you're on the phone telling us what's going on, we can tell you what to do, and you're helping right away. And that's a big, big factor. You also need to let us know what your phone number is. So if we need to call back or if we get disconnected somehow, we have a way to get a hold of you again. So providing that is important as well. Some other things that you can do is have someone meet the responders at the entrance or out on the street and help guide them to where the patient is. This is critically important in large buildings. I can just remember some of the sorority houses and fraternity houses that I was in. They were huge and had, dozens and dozens and dozens of rooms, and it can be very confusing for responders who are trying to find where someone needs help. So having someone go out to the street, meet them in the street, and then take them exactly to where the person is that needs the help is a critically important factor. In the event of a heart attack or unexpected cardiac arrest, you can initiate CPR. I'm sure that many of your dorms and even some of your houses may have an automatic external defibrillator. Those AEDs are fantastic because they walk you exactly through it. As soon as you open it up, there's a voice, the recording that's telling you exactly what to do and how to place the pads on the chest and all of that information to be able to help the person who is in need. Other things that you can do is if there is an allergic reaction, you can find out if they have an EpiPen and get that and even apply it. And if there's a fire, evacuate the building if it's safe to do so. Make sure that the alarms are sounding. Make sure everyone knows that there is a fire and knows to leave. I remember when I was in college, we got a lot of, prank fire alarms, and after a while, you hesitate to leave because you're not sure if it's real or not. And that's important that if it is a real fire, that you let everybody know it is real, and never delay calling the fire department to fight a fire yourself. The reality is fire expands at an exponential rate. It doubles in size every 6 minutes. And so if you delay, a fire can get out of control very quickly. And so it's important that you always immediately call the fire department if there is a fire in your house. Talk a little bit about the liability and why all of this is important. And the reality is this: in some states, you have a legal duty to act in the event you were aware someone is needing some sort of medical assistance. If you don't, and you are in that state, then the consequences could mean that you could be held liable for it, criminal or civil penalties. You can expose your organization to significant legal and financial risk if you don't do the right thing. If you're a fraternity or sorority and you're strongly encouraged to develop an emergency action plan, and make sure that all of your residents are familiar with it so that if something does happen, they know exactly what to do. And we have to train on that, and that means we have to do some drills. And it's more than just once a year. You have to do it pretty regularly so people understand what to do. And I know that seems kind of lame, but it's important because in an emergency, you're going to kick back to that time where you did those drills, because that's when you know you've learned it. It becomes muscle memory, and you just go and do it. And then make sure you have smoke detectors on all levels and in and or near sleeping areas. And what we're trying to get you to do, and by doing these 4 steps and some of the other things that we're about to cover, we want to limit the liability that happens within your organization. We want to avoid having these being actual headlines. These are headlines that I found in the last week about, incidents that have occurred on universities and in Greek houses. And I'm struck by the one here. 25 years later, a hazing death, consequences remain. These are long-term, long-standing consequences. They don't go away at the end of the night. Fraternity brothers plead guilty and receive jail time. It's not going to go away at the end of the night. And then the parents of a pledge sue the fraternity members after their son's death. Not just suing the university, not just suing the fraternity or the sorority, but actually the members that were there who failed to act. And you can be held civilly responsible, and that means financially. I mean, you're going to, if found guilty, you would be fined or have to pay really a lot of money, and that can have a long-standing effect on your life. And we don't want that at all. We want to make sure that everybody's safe and is able to go home. So what can you do to help? Well, make sure your fraternity and sorority is a safe place and is a safe house. Do free training. There is a lot of free training that's out there. The American Red Cross CPR training, and this picture here on this slide, these are members of the Theta Chi fraternity in Lehigh University in Pennsylvania, learning to do how to do CPR. I think that's fantastic. These are life lessons that you will remember and use well beyond your college years, and it's an important thing to be able to know how to do CPR. Getting involved, disaster assistance teams is a great way to give back to your community. Community disaster exercise volunteering. So there are oftentimes many municipalities have to do disaster exercises, and they do them every 1 to 3 years. When I was the director of emergency services at Indianapolis International Airport, we had to do an exercise every 3 years. We used volunteers, a lot of volunteers from local universities and colleges, to help us play victims for us to be able to do our exercise, because it was a full scale. So there's ways that you and your organization can get involved and understand the bigger processes of 911 and public safety, and help us in that realm be able to do our training better. Get connected with your local police departments, fire departments, EMS. They're able to help you with plenty of volunteer roles that they may have. Reach out to Red Cross and blood donations, which I know is a big thing for many of you as well. The reality is you're not in this alone. Your local law enforcement, fire, emergency, EMS agencies have got a lot of opportunities for training and insight. They are subject matter experts who can come in and help you make a plan and do different things. Your university or college probably has a safety office or a safety officer that can be a point of contact that you can reach out to and get more information. There's also resources like ready.gov. And this is a great resource for you as an individual, and making sure that you share this information to all of your members in your organizations. Everybody needs to go to ready.gov and understand the processes of being ready for incidents that occur, disasters that may occur. But specifically, there is a section of ready.gov that covers campuses and universities. Just some of the highlights of some of the resources that they have are resources for creating an emergency plan for members of your organization that may be disabled, evacuation tips, creating an emergency operation plan for, institutions of higher learning. All of those resources are available there at that website, as well as a ton of individual resources. And I encourage you to take a look at that. I think it's important for you to understand if there's a disaster, if there's a tornado or a hurricane or something that occurs in your area. The reality is a lot of times local law enforcement, local public safety can only do so much, and the federal government will step in, but it takes time for the federal government to get there. And everyone needs to be able to handle themselves and sustain themselves for a minimum of 3 days. And so how can you and your organization prepare your homes and your houses to be able to sustain that over what doesn't seem to be a long time, 3 days, but think about not having power, not having access to food for 3 days. That could create problems and could be a long time, even though it's a short time in most of the days. You're also not alone, because you've got local hospitals or medical facilities that will help you, and even maybe come in and talk about alcohol or substance-related medical emergencies and what to do. But the key is, if you have one of these, make sure you dial 911, because that's where you're going to get the immediate assistance. We don't want you to try and take these matters into your own hands. Let the professionals come and assist and get the help that they need, your fellow members, the help that they need. Form a safety or RIDE programs to prevent sexual assault and other prevention training that you can have, and do whatever you can to just help keep people safe and on your university and within your organizations. I think there should always be someone who's there and available. If someone doesn't feel comfortable, reach out and have a group of people go get them. And it's always better to walk in groups and then individually, especially at night, and especially when you may be somewhat incapacitated. But most importantly, you may be the person that helps to save a life. And you have to make sure that people get home. You got to make sure that if someone's sick, that they're not alone. If they've fallen and they've hit their head, you need to stay with them. Make sure that they don't lose consciousness. If they're just sick, everybody wants to be, taken care of when you're not feeling well. So it's important to be able to do that. Know what to do in the event of a drug overdose. Do you have kits that you can deploy in your home if someone were to have a drug overdose. And again, don't hesitate to call 911 in the event of any emergencies that may occur. Because of all of this, it is the greatest leadership moment of all, being able to save someone's life and make sure that someone lives for another day. Because I want, and all of us at NENA and in the 911 industry, we all want you to have a great experience. College should be fun and exciting and something that you will cherish for the rest of your life. And the lessons that you can learn here can have a huge impact on you moving forward, as much as anything else that you will do. And college will help to show you how to be a good citizen and a good person, and that's the best thing that we could ever ask for. And we want to try and do whatever we can to make sure that everyone has a good time and is there to graduate at the end of the day. So at this time, I think we're open for any questions that you may have.
If you have any questions, please go ahead and send those through the message area in the lower left hand of your screen, and then I will relay that to Ty.
I will share a couple of the resources that I used for this presentation, just as that, and you can look at those at your leisure, and we'll make sure that we get those over to everybody so that they can share those resources out as well.
Ty, our first question has come in from Karen. She indicates that we've had this is great information. Are we able to get a copy of the PowerPoint to share with members and chapters not on the call?
Absolutely. We will definitely provide that for you.
Great. I'd also like to point out that this presentation is being recorded and will be available on our website as well. Levi has a question. For a state that doesn't offer medical amnesty, what advice would you give to Greek life here?
Do it anyway. Make the call. Because the reality is this. First, I guess I have two points of suggestion. One, if you're in a state that doesn't have medical amnesty, then I think one of the things that you could do is to help educate those legislators in that state to adopt it. It's been adopted by, I think, 41 states, so it's not like it's something unique and not something well respected or understood. So one, be an advocate for getting adopting that legislation in your state. Two, on a more pertinent level of when you're having one of these things that occurs, still make the call. Do the right thing. And the reality is this, as a former law enforcement officer myself, as a former firefighter and EMT, and run 2 different 911 centers, if you're willing to step up and do the right thing, make the call, stay there, make sure that the person who is in need of assistance gets the help that they need, and you cooperate with the law enforcement and other public safety officials on the scene, 99% of those professionals are going to respect you and take care of you because of the things that you've done the right thing. There's always the 1%, and that's you have to deal with that risk. But the reality is this: if you're doing the right thing, we're going to make sure that that's noted. And I can't guarantee it, but the reality is also death is the only thing we can't get away from, and it's the hardest consequence. So do the right thing to begin with. I hope that answered your question.
Levi responded, Ty, saying thank you for the response. So I believe it did.
And Levi, I would just point you to that middle bullet point there, medicalamnesty.org. That is the initiative where they're the ones that are helping to push that law. And if you're in one of those states that doesn't have it, I'm sure they'd be willing to help you and talk about the importance of it. Just like that, some of those statistics we talked about earlier, I think they speak for themselves.
We still have some time slotted for this presentation, so if you have questions, please bring them forward. We're happy to have Ty answer those for you.
And if you have questions later, I've also volunteered to answer any questions that may come in after. If you show this or share it with other members or other chapters who are not on the call and they have other questions, you can reach out to the Holmes and Murphy's folks, and they'll get those questions over to me, and I'll be more than happy to answer them. I know it's a heavy subject for a Thursday night at 8 or 7 or whatever time zone you're in. So I appreciate all of you being here, and hopefully you got some information that you can share. Ultimately, we want to make sure that everybody goes home and goes home safe. At the same
time,
I
please ask a question?
Sure.
Because I'm not on the Skype part of this connection. I'm actually on a cell phone. Since members could be taken to the hospital, would it be possible, or would you recommend that we get information concerning our members ahead of time, concerning maybe medications they may be on, or even parental contact information, that type of thing, like have them fill out that type of information survey?
Sure. Thanks for the question. Yeah, you can do that. You have to be a little bit careful about how that information is kept. And most of the time it would have to be voluntary. It couldn't be cursory or required. So you can do that, and if I would encourage you to do it, but you also have to understand how you maintain that information and where it's kept and who has access to it. Because it does, at that point, it is personal, private information, and it would require certain safeguards being held.
Thank you.
No problem.
Does anybody else have any other questions that they'd like to ask at this point? Ty, I think we're coming to the end here. I don't, other than those questions that we've had, I don't have any others. Do you want to continue to wait for a little bit, or do you want to wrap it up?
No, I think we're good. We'll give everybody back 5 minutes of their lives.
Absolutely. All right. Well, thank you all for attending. That's all we have time for today. Thank you to all our participants today for your great questions and comments. We will send a follow-up email to all participants when the recording becomes available. Holmes Murphy's fraternal practice is invested in developing and sharing relevant content for fraternal organizations. We are glad you were able to join us tonight. Upcoming webinars will feature issues related to men preventing sexual violence, mental health, and incorporating your organization's values into programming, as well as our Coffee and Conversation series. Information on these and other webinars can be found on our website, holmesmurphyfraternal.com. Feel free to contact our presenter or me using the information provided for any follow-up questions or conversation. We appreciate your interest in this topic and thank you for your participation. Good night.